All right, everyone. Thank you all for joining us today. My name's Caitlin, and I'm the Alzheimer Services Coordinator here at the Humboldt Senior Resource Center. Today's workshop, we are joined by Lynnette Chen, attorney at Open Door. And Lessons in Dementia is a free virtual workshop brought to you by the Humboldt Senior Resource Center and the Adult Day Health Program. The Adult Day Health Program has day programs located in Eureka and Fortuna and serves those with disabilities ages 18 and over. To learn more about our programs and other offerings of the Humboldt Senior Resource Center, you can visit our website at www.humsenior.org. And I will be able to put that in the chat as well. This session is being recorded, as you may have heard, and you can find this session and all past sessions on our website that I mentioned, the humsenior.org, or the Humboldt Senior Resource Center YouTube channel, which I will put that information in as well. Today, Lynnette will be talking to us about her firsthand experiences as being a caregiver to someone with dementia and providing tips on managing this. Please feel free to ask questions throughout the presentation, and at the end of today's workshop, there will be a brief survey that we encourage you to participate in. Lynnette, I'm going to go ahead and pass it over to you. Thank you so much for being willing to do this today.
Thank you, Caitlin. Okay, so I figure that one of the most important things that I can tell you is where I am on my journey. Everybody's journey is a little bit different. Everybody's in a different place in the journey. And if you can get a sense of where I'm coming from, then you can see, you can take the pieces of advice that worked for me and that might work for you, and you can completely ignore the ones that won't work for you. So that being said, let me just give you oops, here we go. The first thing, which is my personal timeline. And then, well, let me give you the overview. First of all, I'm going to give you my personal timeline. Then I'm going to give you some tips for working with yourself. Then I'm going to give you some tips for dealing with your patient with dementia. And then I'm going to give you some tips for dealing with other people. And then just a little wrap up at the end. Okay. So my personal timeline is that I believe it was in 2012, my husband, Steve, quit his job after some performance issues. He'd missed some meetings. He had had a hard time learning new material. And so he quit his job. He didn't have anything else lined up. And I figured, you know, that might be stress related because the job was stressful and it might all be fine. Somebody said they can't hear me. Is that clear now? Oh.
I can hear you, Lynnette, if that's helpful.
Okay. Oh, maybe the closed captioning will help.
Okay.
Can anybody else hear me?
Maybe someone's volume isn't on. I can hear you.
There's some waving hands too, so that helped. Okay.
I can hear you.
So
I can hear you.
You can? Okay. So yeah. I'm going to presume it's okay and keep going. So in 2013, a friend expressed some concerns that he was not remembering things that he should have remembered and that it was not like him. And he came to me, he was quite concerned, and he came to me and I was like, okay, this bad memory thing, I actually need to deal with it as a serious thing. But the first thing was to find him a new doctor, because his doctor that he had, let's just say charitably, I was not happy with. So it took a while to find him a new primary care provider. We went to the primary care provider maybe 4 or 5 months after I started looking, because it took a while to get one of those appointments where you're first establishing care. But in that first appointment, we mentioned memory as an issue, and The doctor looked a little skeptical, but went ahead and asked what I was concerned about. And then his eyes went wide. And then he started doing the tests in the office and gave us a referral to the neurologist by the end of that first appointment. So he was a little skeptical because at the time my husband was 54. We had maybe 3 or 4 visits to the neurologist. Oops, there's some chat which I can't read because let me find that.
I'll monitor it for you, Lynnette.
Okay, great. Okay. We had 3 or 4 visits to the neurologist as the neurologist was progressively removing things off the possible list of things. Was it vitamin B12 or whatever? I mean, he went through a bunch of things to remove, and ultimately he diagnosed Alzheimer's that year. He immediately gave us a referral to UCSF to get a second opinion and see if they had any new treatment that he was unaware of that he could that could be offered to us. And we went down to UCSF. They were wonderful. We went through 4 different clinical trials. And then when that was done, we did all the paperwork for getting him enrolled in disability and doing our estate plan and all those things that need to be done. And let me just say, from the time of his diagnosis, I was a complete basket case. I was going to work. I was pretending that it was all very well, except when, when colleagues would ask, I would tell them. But when, you have to hold it together for your actual professional life. Let me just say, when people asked how I was, I would tell them with waterworks like that, which I figured out actually at that time was completely non-fatal. Like nobody said you're so unprofessional. Everyone was super supportive. So I'm just handing that to you as a piece of experience that might be useful for you. In 2016, probably summer, I'm not exactly sure. I had been looking for support groups and they all were meeting at times when I was working. And I was like, look, I'm a working person. I can't do this. So I actually talked to a friend who said, you're having such a difficult time and I don't feel like I have any resources to help. And I have another friend in the same situation and I can't help her either, but I wonder if you could help each other. So she connected us, and the first thing when I called her, the first thing we did is we made an appointment to meet for lunch on Tuesday. And let me just say, we've been meeting for lunch on Tuesday since 2016. We miss a couple things come up. And she had the same kind of situation that I did. She was maybe 4 years further down the road, but she too had a spouse who was diagnosed early with Alzheimer's. And then I ran into an old friend that I hadn't seen in many years, saw her in the pet store, and she had that glazed look that you recognize on yourself because you see it every morning in the mirror. And she said, did I tell you my husband was diagnosed with frontotemporal dementia? And that was maybe 3 or 4 months after I started meeting with the first woman. So I said, oh, you have to come to lunch on Tuesday. So then she started to come. So it was the 3 of us for some years. We tried adding people and it didn't work out. And then ultimately we've added more people that have fit in nicely. We started calling ourselves Ladies with Demented Spouses. We added subsequently somebody whose spouse had dementia and was deceased, but was caregiving with a mother who had some dementia. We added somebody whose husband didn't have dementia, but he had some other physical challenges, a couple people in that category. So we call ourselves Ladies with Demented Spouses, but that's a pretty big category, right? And let me just say, some point around 2016, I felt the depression starting to lift. I don't think it's a coincidence that was when I found a group of women or a group of people that I could talk to about all the things and be authentic with. And not just that they were supportive, because I had lots of supportive people, but they got it. They'd been there. So I was carrying on and, you know, getting on with it and doing life and doing all the things, and working. And in 2018, I got diagnosed with breast cancer, which I did not have time to deal with. And I followed the recommendation of my care providers. I got surgery. They said, get surgery. I did. They said, make sure you get a mammogram in a year. And I did. Yes, I had clean margins. It was all fine. Off I went and carrying on doing all the same things. In 2019, I got my follow-up mammogram and got a second cancer diagnosis. Yes, it had spread. Yes, it was in 3 different spots. And yes, this was going to mean a mastectomy. And I thought, if you do not listen to your body this time, next time it's going to have metastasized and you're going to have brain cancer or lung cancer or something else. Like, if you do not listen to yourself, the outcome of this will not be good. So at that point, I had already found a care home that I really liked, because this was part of my coping strategy, is to do all the things that you can do, since there's so much that you can't. I organized, and I had asked my husband if he wanted to help pick a place, and he said no, and I said okay. I actually went to some of the care homes with some of the ladies with demented spouses who went with me and like were supportive. And so I said to him on the Sunday, I was due to have my surgery 8 days later or 7 days later. And I said to him, I'm going to have a mastectomy. It's going to be major surgery. The thing I'm worried about is you. And I'd like to put you somewhere so I don't have to worry about you while I'm undergoing cancer treatment. And he said, anything you need. So he was distressed and he didn't want to be there, but he was willing to go. And so I had the conversation with him on the Sunday. We went to visit the place on the Sunday. We brought the first batch of things on the Sunday. The Monday, he went to adult day, as he normally did on a Monday, and the bus brought him back to the new location, and I met them over there on the Monday. And he has been there ever since. So I had 6 or 7 days to recover, to try to make myself tranquil after he was gone. And I got the surgery a week later and went through recovery and all of that. In 2020, in March, we had COVID and the care home locked down, and I was not able to see him for 5 months. So I was not able to see him all the way through, I think, August or maybe the beginning of September. And I still go back. I now see him once a week, which is about all I can emotionally manage. And also, you know, I'm now working full time instead of working 25 hours a week. And so that's really all I can manage emotionally. In 2022, so last year, I repartnered. I was fortunate enough that he said to me, you should repartner. He said this to me, you know, when you have somebody with dementia, when they say something to you once, you cannot trust it. But he probably said that to me 50 times. You need to repartner. You need to find someone. Don't tell me about it. Keep visiting me wherever you put me in, whatever care home you put me in. You should not be by yourself. Okay, so he gave me that gift. So that's my personal timeline. That's kind of what's happened that's relevant to this caregiving experience. That's where I am. Okay, so there are some useful things that I have found internally dealing with myself that make it, I can't say easier, but survivable. One thing is, the first thing, and this is not in any particular order, this is just like I blatted all this stuff out and then I organized it a little bit, but these are just the pieces that came to me. The first thing is, dementia is a terrible thing to deal with. It is terrible. Don't minimize the terribleness of it for yourself. You need to cut yourself all the slack in the world, because this is a terrible, terrible disease. The whole complex of things that make up dementia are terrible. And then the second thing is, let yourself be sad. it helps you. If you try to pretend that it's all okay all the time, you can get a lot more done. But sadness unexpressed and left festers inside, and it makes you sick, right? So the crying is inappropriate, and it just is what it is. And people who love you will just deal with it, and so will you, and it will all be fine. And then the other thing sort of in this category is, don't think you always have to be sad. When you're not feeling sad and something's funny and it makes you laugh, and you look over at your partner and you're like, oh, I can't believe I'm laughing when they've got Alzheimer's. That's so terrible. Like, it's okay. It's okay. You're being sad doesn't help them. And sometimes you're having a sense of humor about it can help. Not always, it depends on your person, but like, don't think your sadness is in and of itself something that you need to hang on to. Right? Feel it when you feel it, but don't like grasp it and make it your best friend. Another piece that I think is really important, has been super helpful for me, is detaching my ego from my husband. So for you, that might be your mother or your dad or your sister or brother or your spouse, but whoever it is, they're going to do something demented. They're going to look inappropriate. There are going to be times when they haven't combed their hair or brushed their teeth. Or in a classic example from my spouse, they intentionally were wearing mismatched shoes to show that wearing matched shoes didn't matter. So at a certain point, you need to just say, oh, this is the dementia. This is not me. This is not a reflection of my ego. This is not like, are people judging me because I'm with somebody who's not well groomed? Not my problem. Not my problem. I just need to let go. So the more you can do that, the easier your life will be. Emotionally easier. It doesn't make any difference, right, to what you actually do. You might still want to, brush the food crumbs from off their face or whatever it is, but don't make that be about, I'm so embarrassed about this person for me. It's not, there's nothing you can do about it, fundamentally. Okay, so there's a couple things that I found were super helpful. Short-term breaks, basically. And one is when you were stuck in the moment and everything is horrible, think about the longer term. Over the long term, oops, sorry, that's my light. Over the long term, and I mean, on the scale of the sun going supernova, it doesn't matter. Over the short term, the next 2 minutes, the horrible thing that they might do next and haven't done yet, doesn't matter. So you can give yourself a super short break just by saying, oh, I can take this tiny moment to reflect on the super big picture or the super small picture. I can look at it globally, like big geographically, or really small. Okay, at least my cup of tea is warm as I sit here in the middle of this giant cluster, right? So changing your perspective is a way to get yourself out just for a brief moment. And then another thing that's really helpful is go outside. Go outside, hang out with a tree, 2 minutes, look up at the clouds. Or if you're somewhere that's not Humboldt County, look up at the sun. Just to connect with something larger than yourself. Connect with something that's not human, right? The dirt, the tree, the house plant, whatever it is, that's helpful. If you can do something creative, that's wonderful. It doesn't have to be big. You can doodle. You can write a haiku. You can draw a stick figure. Draw a stick figure stabbing the person that it's caregiving. Whatever that it takes, like whatever creative thing you can do, Those things will not hurt your person and they will help you. Okay, so do something creative, make it small, make it whatever you can do. That is a thing, that is the only thing that I know of that reliably fills my tank. Right? Might be gathering one flower and putting it in one vase and putting it on the table. That might be enough. Okay, I'm a person who likes a plan. And I can assure you that no plan survives engagement with the enemy. The enemy might be time, right? Your plan might only last 10 minutes before you have to amend it. That's okay. The plan might be comforting. Just be aware you are going to have to amend. And then kind of looking at the big picture, what I have found is your heart breaks over and over again. And what happens when a heart breaks is there's cracks and there's bleeding, and your heart stretches a little bit more, and then you heal a little bit. And then it breaks again, and there's cracks and there's bleeding again. And your heart expands a little bit more, and you become a little bit more compassionate once your heart heals enough that you can access that. It takes a little while. And there's something I didn't put on here because I thought of it afterwards. But I asked my therapist, and if you don't have a therapist, I can highly recommend that you get one because it really makes a difference. I said to my therapist, pardon the language, there is so many piles of shit around here. There's got to be a pony in here somewhere, right? Where's the pony? There's too much shit that are not to be one. And she said, the pony is resilience. Once you are through more of this experience, you will find that it takes a lot to knock you over. You're going to be able to cope with a lot of things without spinning out of control. And so that's the pony, just so you know. Okay, so that's dealing with yourself. So I've got some thoughts about how do you deal with your person? The first one is probably the most important. Lower your standards, repeat as needed. So that goes for all the grooming things. That goes for all your self-judgment about what kind of caregiver you should be, and you should never have yelled at mom because, right? That goes for all the judgment about, I can't believe I let him get out of the house looking like that, right? Oh, I should have been better. I should have caught him before he put the pan on the stove. I should have caught it before it caught on fire. All those things, lower your standards, repeat as needed. Okay, next thing. And it might be different if you've always been dominant in your relationship. But at a certain point, the person who's the caregiver needs to be the big dog. They need to be the one who's telling what's going on. They need to do that in a way that the person with dementia understands at some really basic level that they are not in charge, the other person is in charge. If you do not do that, then the person with dementia is driving the bus. And it's the dementia that's driving the bus. And it's really important to not let dementia drive the bus so that you can still get things done and do what you need to do. So if you can early on say, this is how it's going to be about one or two things that really matter. In my case, one of the things that it was about was, you're going to adult day. I know you don't want to go, but I need you to go. So my husband was like, all right. But then he grumbled afterwards. Oh, I don't want to go. And I'm like, my ears were up. My tail was not wagging. And I was like, you need to go. And he was like, oh, okay. So that's a thing that's really helpful to get that instituted early enough on that you set a pattern. Okay, so as your person diminishes, like there is an old person in there, the genuine 100% person, and you should honor that. You should respect that. but the person that you're dealing with is the current person, who might be the 75% of the person, or the 30% of the person, or the 5% of the person, right? If there's only 5% left, it's still them, but it's only 5%, and you need to deal with the person that you have, not just the person you used to have. Every solution is temporary, right? You solve something and then you have to do something else because of the changing nature of what's going on. Don't hold yourself to an impossible standard of care. C, lower your standards, repeat as needed. And I have a little story about that because it was both amusing and horrifying at the time, which is I had, was taking my husband to the dentist maybe he was normally going like once a year. And then I was taking him every 6 months, and then they were saying, oh, we should see him in 3 months. And I'm like, okay, fine. And we should see him every 2 months, you know, as his oral hygiene got worse, because I was not brushing his teeth. I was like, here, dude, go brush your teeth. And then he was in residential care, and they were saying, you know, time to brush your teeth. And if he didn't do it, well, I mean, there you go. So they said, you need to bring him in once a month. And I'm like, no, we're not doing that. There's plenty of people who don't brush their teeth and don't go to their dentist once a month. We're not going to do that. That's too much. Every 2 months is pretty dang often. So somebody at the dentist's office reported me to Adult Protective Services. I was horrified. The first thing they did is they checked with the care home. And the care home said to them, oh, yes, you know, Lynnette came in and she told us about what had happened. She told us, yes, she was going to keep taking him back every 2 months, but once a month was too much. And no, there's no abuse going on. Don't worry about it. So they said, okay, we're going to close the case. But if she wants to talk to us, she can do that. So the care home let me know that I had been reported to Adult Protective Services. And naturally, I called them immediately in a complete panic. And they said, and now here I'm passing this piece of wisdom on to you. There is no standard for how often you need to bring your demented patient, or indeed any patient, to a dentist. There is no standard. You are not violating the standard if you never bring your patient in. So, like, think about the standard of care that is necessary. And my standard is I'm doing palliative care. If something's going to cause him pain, I make sure it gets taken care of right away. And your teeth can cause you pain if we're getting his teeth cleaned, but that's it. Okay. There's something that you often hear, a tip you often hear, which is the tip of the compassionate lie. That is, they ask you a question and you just lie about the answer because it's easier. It's easier for you and it's easier for them. And I'm a terrible liar, and that doesn't work so well for me. But what I've found is the truth is too complicated. So don't tell the complicated truth. What you need to do is tell the truth. Tell the thing that's the core truth, the thing that you can get behind, the thing that they can hear and understand, not the complicated truth. So you don't say, when he says, what's an example? He says, so, are you married? Are you still married? And I sometimes will say, yes. And sometimes he thinks that that means I'm married to him. And sometimes he doesn't think that because he doesn't know that I'm married to him. But I don't say, well, I'm still married to you, but I'm seeing someone else, right? I say, yes, I'm still married. He says, are you happy? And I say, yes. And there was one occasion when he asked me that, and I was fairly newly repartnered, and there was a pause, and I said, yes. And he's very astute, like he's nowhere, but emotionally, he's very sophisticated. And he said, oh, you don't want to talk about it. And I was like, oh. And I had to think, what's the truth I can get behind here? And I said to him, you asked me not to talk. You asked me not to tell you. And he said, okay. Right? That was true. But So don't tell the complicated truth. Tell the truth you can get behind. And the other thing I would say is if you have a patient with dementia at home, you will often hear, oh, just slide into their little world, right? And just interact with them the way on their terms. And I can tell you that's great advice when you're visiting your person in care. It's great. It works really well. Or you're visiting somebody else's patient. That's great. But if you have a dementia patient at home, you cannot do that. What that does is it says, go into Crazyville with a crazy person and live in Crazyville. And you cannot do that. It is not sustainable. It is just horrible. Don't think you can do, it's great advice when you're just visiting, but it is not okay to live with someone crazy and spend all of your time in their crazy world. Somebody's got to be on the outside, and that's got to be you, right? You have to be sane. And so you can't go there all the time. And so that advice, while it's great advice for somebody who's visiting, feels really toxic to somebody who's living with dementia. Okay. And then this is a piece of advice because my mother-in-law, also had to deal with, her husband also had dementia. Don't put everything on hold because change would upset your person. Sometimes things have to be done regardless. If there's some short-term upset with a long-term gain, you probably just need to do it and deal with the consequences in the short term. So that's a piece of not letting dementia drive the bus. Right? Okay. So these are some tips for dealing with other people. And dealing with other people is frequently feels like the worst thing. It isn't the worst thing, but it sure feels like it. Before we got a diagnosis, the friend who said, I think there's something wrong, said, oh, I found this thing, subsequently found this thing and said, oh, there's something about gluten and Alzheimer's and memory. And he sent me a link and I looked it all up and I'm like, okay, we're going to go gluten-free. And we took him off gluten. And we ran into somebody else who said, oh, there's, you should make sure they're getting plenty of CBD and not THC. And so you can take fresh marijuana leaves and put them in the blender with some fruit juice. And then you can put them in an ice cube tray and freeze it. And every day your person can have one ice cube. And it will be this fresh frozen CBD and there's no THC in there. And it's so good. And we did that. And there was lots and lots of dietary things. Oh, make sure you're doing this and that. And at a certain point, when we had our diagnosis, I pretty much said, okay, I'm going to surrender. I don't have time to go and do the research myself. Like I can't do the double-blind clinical trials and figure it out what's actually going to work. And what I'm going to do for my own mental health is I'm going to trust my Western medicine doctors. And they pretty much say there's not much that can be done. And I'm just going to deal with that. Like it's a lot easier for me than trying to feel like I can make a difference when the double-blind clinical trials haven't shown that I can make a difference. So subsequent to my, our getting a diagnosis and all those things, I had somebody say to me, and she was a nurse, Western medicine really understands nothing about Alzheimer's. And I was like, oh, that's so helpful. Because I have plenty of time to go and get a degree in Western medicine and make sure it does, or time to go and learn Eastern medicine and figure out the solutions. Like, so my advice is other people's medical advice isn't all that useful. And it's very stressful and it makes you feel like there's more you could be doing. And you're already doing enough, right? You're already doing more than you can probably cope with. So like just smile and agree. Oh, that sounds like a great idea. It sounds like that might be really helpful. and don't pick it up. Don't put it on your to-do list. Another piece is not to take responsibility for other people's sadness about the situation. They're sad, you're sad. You tell them and they're so sad. And it kind of calls out in our culture for the person who gave the sad news to then help prop up the person they gave the bad news to. Don't do it. You don't have the time, you don't have the bandwidth. Their sadness doesn't help your person, it doesn't help you. And I sometimes have said to people, I know you're sad, that's okay, but just know you don't have to be sad just because you're with him, because it doesn't help him, and it doesn't help me either. Like, you can be as sad as you want to be, but don't think that that's making it better for me or for him. That's making it better for you. Or it may be making it better for you. Find others in your situation to laugh and cry with, be real. This is again circling back to that, the ladies with demented spouses, God bless them, with whom I would, if it were not for them, I would not be okay. I have heard of groups where people have said things like, oh, you know, I'm really, it's hard looking after mom, but I'm so grateful we have her. And, you know, I just feel so lucky that she's still with us. It's like, maybe you feel like that sometimes, but you want to be in a group where at least sometimes they can say, oh my God, I just wanted to smother him with a pillow. I didn't, but I wanted to, right? Because that's the kind of person that kind of trust in the group is what is the most helpful for you in sharing your experience and feeling heard. Like, I do not feel grateful. Okay, sometimes I feel a little grateful, right? But most of the time, I just feel like, oh, this is the pits. And I don't want to have to be grateful in my support group. Okay, so be real. Next tip, get practical help. Adult Day, great resource. I can't tell you how useful that was. It was useful both when he was living at home. It was useful as a transition to get him into residential care. He is still going to Adult Day a couple times a week. And that is provided him continuity and is really helpful. I got daytime caregivers. I didn't hire people with lots of experience, but I hired some young men with a sense of adventure to go take him out, to go do things that he wanted to do, but couldn't manage himself. Take him to the beach, take him for a hike, take him to the Teloniker lab so he can go see the ocean animals, like go do things with him that he would like to do. And that worked for a while. Again, every solution is temporary, but that worked sometimes. I had some neighbors who checked in with him for a while. Again, every solution is temporary, but get practical help if you can get it. And then super important thing. There are many people will say to you, if there's anything I can do, this is so terrible. If there's anything I can do, please let me know. And that's a really frustrating thing to hear because I don't know what you can do. I don't know what your capacity is, and I don't know if I need the things that you can actually do. So what I came to after some time was to say to those people, look after our friendship. I love you. I will make time for you. But I don't have the bandwidth to call you. If we haven't seen each other in 3 weeks and you think that we should see each other every 2 weeks, you call me. I'm not making the call. I'm not organizing it. I'm just releasing all those duties in the friendship to you. You deal with it. And I lost some friendships over that, and it was wonderful. Because those were the people that were really exhausting for me. And what I ended up with is the people who looked after the friendship for me. And they were so supportive, and it was lovely. So I cannot tell you how important it is to free some time up so that you can hang out with the people who you can be real with, right? So just tell people, I can't do it. You're going to have to sort it out. And if they call you and you actually want to see them, then go ahead. But don't like take on yourself the burden of looking after the friendship. Okay, here's my final thought, or my final set of thoughts, my wrap up. You are the linchpin. It doesn't happen without you. The person will be in some hideous situation if you are not there. So you are absolutely critical to the process, which everyone tells you, but it is still true. You must be kind to yourself every day, which everyone tells you, and it's still true. And when I say kind to yourself, the things I have in mind are things like go outside, be creative in some very small way. And you know, do the things you can to get yourself a little bit of joy to fill your tank. And we have this ideal. Our ideal is the angelic doormat, right? The ideal is he yells at me or she yells at me and tells me I'm terrible and does all these awful things, and I smile and I clean up the mess and I sacrifice myself as a martyr to the altar of Alzheimer's. And that does not help. It doesn't help you. It doesn't help them. It's not the ideal, right? That's who we think the ideal is. First of all, that isn't the ideal. And the second thing is, that's not you. It's not anyone. So don't figure out, you need to be yourself and do what you can do. And if you do more than you can do, that's not sustainable. You got to figure out ways to cut so that you can cut the things you're doing so that you can keep doing them, because you might be doing it for a while. Okay, so that's my advice. Do you have any questions for me?
Well, first of all, I would like to jump in and just share how I want to say the word scorching because I've been choking back tears listening to you talk. There's so much courage here in this story and so much honesty. And I think we all needed to hear that. And just thank you so much for sharing this very, very personal story and not holding back.
Thanks. For Robert, I think that the PowerPoint I sent on is probably going to be posted on the website along with the talk. Is that right?
Yes, that's correct.
Okay.
Does anyone have any other questions for Lynnette?
I don't have a question. I just was listening to all of your advice and so deeply appreciative, because everything that you were saying, that's the world I want to live in daily with everybody, not just under painful circumstances or challenging circumstances. So I just appreciate your candidness and appreciate the clarity around how you're managing your needs and your spouse's needs. And thank you. That was so validating and important to hear. Thank you.
Sure. I can give you one other piece of possibly inappropriate, but possibly really useful advice.
Bring it on.
Which I didn't put in the notes, but and that is for anybody who's caregiving their spouse. When's the appropriate time to stop having sex? And the answer is when you don't want to. You don't have to keep doing that for the other person. You have to do that. That has to be okay for both of you. And one of the both of you is you.
Any other questions or final comments for Lynnette?
Lynnette, have you been able to see the chat? Okay.
Yeah, I can. That's why I stopped sharing my screen.
Oh, gotcha. Good.
Well, Lynnette, I just wanted to say thank you for offering your time and your story. It was very touching. And by the looks of the comments, it reached a lot of people today. And I just wanted to give a reminder to everyone about the survey at the end. And also, we have our lessons in dementia next month on September 18th. It's a Monday again at 2 o'clock. And our presenter will be Dr. Jennifer Heidman talking about dementia and research. So we hope to see you all there. And thank you everyone for attending today and continuing to support our lessons in dementia workshops. Right. Hope everyone has a good day.
Thank you both so much.
Thank you.